Alrighty everyone, this video is going to be about Ella's surgery day. I did post two videos. One is of her pictures, and there's only a couple, and then one is of just, a small video of the day. But I wanted to tell you guys in my own words, like how the day went and everything. First of all, I woke up at 4:30 this morning to try to get to the hospital at 6 o'clock. Her surgery was at 7:35, so we have to get there an hour and a half early. So we had to be there at about around 6. We were a little late because my husband woke up late, and Ella had woken up, and then he went in there to lay down with her, and I forgot to wake him up. So that's the story with that. But anyway, so we went to the hospital. We checked in at the registration desk, and then we went and waited about an hour in the waiting room. They did have like a little PD room, so Ella did play in there. And she had a little 3-year-old boy that, kept her company and entertained. So we also kind of like walked around with her and whatnot. And then we went back to the pre-op area. In the pre-op area, we changed her out of her pajamas. We put her in pajamas because they told us to put her in pajamas or loose-fitting clothing, so that's what we put her in. And I also, before we left, put on little grippy socks because I knew, since I do work down there, we don't have toddler socks that are small enough for her feet. The toddler socks are like that big. They're huge. And her foot is not that big. So, and she's not the average toddler either, but I put her own little grippy socks on because I knew that, she would need little socks. And those probably she would trip over. So, anyways, after that, we waited in there for about 20 minutes, and she went over and played with some toys that they had in the pre-op area. She loved this little table. There's in the video, that's like one of the first things that you see. So anyways, after we filled out all the paperwork, we signed the surgical and anesthesia consent, I got dressed because you can only have one parent back there in the OR. So I got dressed into like this blue light gown and a blue hat. And they had a nurse come out to get us, and then also a child life specialist came out. And a child life specialist is somebody who, they play with the kids, they calm the parents down, they just help with the whole surgery with the kids and whatnot. So she actually, had a little toy in her bag, and she pulled that out, and we took that back to the OR with us. Walking back there was a little scary because I knew that she was going to have surgery. I knew what was going to happen, and I had never seen the OR before, not the one in the hospital I work at. So when I went in, they had all these like big bright lights and all these tools sitting around, so it was a little scary. I remember that from my C-section, but I was really like knocked out, so groggy like. Anyways, the anesthesiologist, he had like this, it's like a tube, like a breathing tube type thing. It's not really like a breathing tube, but it's like a tube. Instead of a mask over her face, he had that and was blowing stuff like gas in her face to make her drowsy. And she actually went, I think she was just so hungry that she went and just bit it, put it in her mouth, and then she like slowly went off to sleep like this, and then her body went limp. And then her breathing got really shallow. So it was like, and so that kind of scared me. But the anesthesiologist had warned me that she would do that. And so, anyways, I kind of freaked out about that. But then after that, he like took her from me and he put her up on the OR table. And then that's when I left. And I had to like look back twice just to see that she was okay and whatnot. And it's really hard to let go of your child after or before the or during the surgery. It's hard to let go. I knew that they were going to take really good care of her because I know a lot of the people down there. So anyways, but after that, I went back to my husband, who was waiting in the pre-op area, and we went and got something to eat. And no sooner had we come back up from the cafeteria, this was like 20 minutes later, they told us that Ella was out of surgery, and she was waiting. She was going to be waiting in the room. So we were expecting that she was going to be there, but they had lost her chart or something or left it somewhere, so they had to go find it. And then she finally came in. Post-operatively, she did really well. Like, she didn't cry as much as I thought she was going to, because sometimes when I walk over to that floor, to help out or whatever, I hear kids just screaming. And she was not like that. Usually when kids wake up from anesthesia, they're really upset and they're crying. And she just kind of whimpered, and then she was fine. And she started watching Mickey Mouse Clubhouse. So she had, from the OR, they had bought back this little Pedialyte container with a nipple on top. And I'm like, oh my gosh, like, we were over bottles, like, you know, months ago, but they don't have sippy cups there. And I will tell you, like, what I packed in my diaper bag for surgery day after I finished this story. So, anyways, we did give her chocolate milk, which was a huge mistake because she threw up everywhere. So, dairy products are not great after surgery, and I should have not given her that. But she had, you know, taken in some Pedialyte, and we thought maybe she would be okay to have chocolate milk. Of course, she was not. I was covered in puke. She was covered in puke, and we rode home smelling like puke. So, anyways, but we had to wait for the doctor to come in. The doctor came in, and he gave us ear drops that you put in her ear. They're kind of like antibiotic ear drops. And he said that if she ever got an ear infection again, that's the kind of drops we would be using, because you don't use systemic antibiotics with children with ear tubes. You use the ear drops because it just treats the ears. All right, then there. So, and plus, like, when they have the ear tubes, they drain the fluid out of their ears. And you will see that. So, anyways, but they told us to put cotton balls with, like, Vaseline on them when we first give her a bath and wash her hair, so that, you know, it prevents the chance of the tubes falling out and whatnot. So, but anyways, we did have valet parking, which was great, because then they just brought us our car and we just went on about our way. She did give us a towel so that in case Ella threw up in the car, then we would have that towel sitting there, which I will probably take back to work tomorrow because we didn't really need the towel. So that's her surgery day story, basically. She did really well. She came home and it seemed like she did not even have surgery at all. She just went about her business plan, and she's been eating really well and keeping it down. So she had like 4 chicken nuggets for lunch, which is pretty good for her. So my surgery diaper bag included, I brought extra diapers and wipes, of course. A lot of the stuff that I already, you know, had in my diaper bag. But I put an empty sippy cup in there, and I put some goldfish crackers in there for her, which she didn't ever eat, but they don't have sippy cups at the hospital, which I knew that because I worked there. I knew they only had bottle nipples. And so I did bring an empty sippy cup, and I got the chocolate milk down in the cafeteria for her because she loves chocolate milk, but that wasn't the greatest idea. So anyways, but I was going to bring her an extra change of clothing, but when she threw up, she was wearing the little hospital gown, so I was glad because I didn't bring a change of clothing. I just brought her what she wore, her pajamas. Her socks did get all yucky, but I didn't bring any extra socks either. So I would suggest bringing extra socks and extra change of clothing just in case that does happen, if they're, you know, all grubbed up and everything and getting ready to go home. So they told us not to give her anything to eat or drink in the car because the motion of the car can cause her to vomit. So we were afraid to give her anything after she threw up. But she's done fine today, so. But I brought my camera and my camcorder in my diaper bag, and then I brought my purse with, you know, like personal things and whatnot. I didn't need insurance cards because we had a pre-verification appointment, and they did, like, I called them and they did all that, so we didn't have to bring insurance cards. And we didn't have any meds to bring. Sometimes they'll ask you to bring the child's meds, but we didn't have any meds to bring. Like, all she does, we do like polybiosol, the infant vitamin drops, every so often. So anyways, but yeah, that is my surgery day video. If you guys have any questions, feel free to ask. Put them in the comments below. And thanks for watching.